6 people per day in Massachusetts dying of overdoses. We have a death crisis on our hands in the context of opioids and overdoses that is very similar to what we saw in the mid-90s around the AIDS crisis. We implemented needle exchanges because people were dying of AIDS and because we knew we had to take urgent steps to intervene. And as a result of that, we reduced HIV infection among people who inject drugs by about 90%, very effective in that way. A lot of focus is on preventing new addictions and on treating those already addicted to opioids, and really not a lot of addressing of the people that are in the middle, that have missed the opportunity for prevention in the first place and are not yet ready for treatment or are in the recovery relapse vicious cycle. They are the people that are dying in our streets and in our communities every single day. And that's where SIFs come in. They will address the needs of people that are actively addicted, that are not yet ready for treatment or falling out of treatment recovery relapse cycles. We know SIFs are effective in other communities in not just keeping people alive, which is the core mission, but also in providing a gateway to treatment services, to medical and behavioral health services, for people that are otherwise really disenfranchised and living on the margins, on the streets with opiate addiction. These are programs that bring people in to meet with professionals and to give them an opportunity for hope. When you look back at the history of the AIDS crisis, it was really individuals affected by HIV and AIDS that were organizing and taking action to make real change, to save their own lives and save the lives of their friends and family in the context of what was really a death sentence at the time. And that led to the passage of legislation here in Massachusetts to legalize needle exchange even before needles were decriminalized as drug paraphernalia under state or federal law. We were operating needle exchanges here legally in that, in some ways, legal limbo with drug paraphernalia laws hanging over our heads because there was a death crisis in the AIDS context. Lots of communities didn't want needle exchanges in their backyards, so to speak. But over time, they were so clearly effective at saving lives, reducing infections, that much of the public opposition or fear or misconceptions have abated. Not entirely, but we're in a far better place today than we were even 5 years ago, I would say. The reality is that having a SIF located in a community reduces crime, reduces public usage of drugs on the streets and in public spaces. It reduces the number of people that are overdosing and dying in our communities. Opening SIFs would improve our communities. I don't think anyone can be working on the opioid crisis and not be supportive of SIFs unless they haven't really grappled with what it's going to take to keep people alive. We couldn't solve the AIDS crisis without needle exchanges. We're not going to solve the opioid crisis without SIFs.